quiero presentarles a nuestra primera panelista. Ella es Fabiola Zavalla Guerrero. Es tecnóloga médica con mención en otorrinolaringología, terapeuta de vida pasada, también terapeuta energética, y actualmente se dedica a ambas áreas de la salud. Hoy expondrá en representación del grupo de investigación denominado Research, compuesto por terapeutas de Chile, Argentina e Italia, y dirigido por la doctora Viviana Bistich. Entonces dejo con ustedes a Fabiola, quien nos presentará un interesante tema llamado TBP en pacientes con diagnóstico de insomnio. Bienvenida, Fabiola.
Hola, buenos días, Patricia.
Very good. There it is. So, hello again, good morning, good afternoon, good night, everyone. I'm Dr. Zavalla. I come in presentation of a past life experts who's focusing on the investigation regarding this technique. Today, I'm going to introduce you the advance that we have so far in people with insomnia diagnosis. Next, please. So we are waiting for the next slide. There it is. The group is composed by very many therapists, led by Viviana. This is the specific group that is dedicated to this special group area, and there's more girls also working with us. Mainly, our main focus is the therapy for the past lives, because we effectively think that is a technique that is going to help you to reach many areas of the being. And that's why our purpose, and I'm going to ask you to change slides, please. And we're focused on giving this tool as a transpersonal tool, which supports the scientific investigation using it, and as a complement to all the health areas. Remember that the past life therapy is related to a transpersonal tool, because this goes beyond the being. It doesn't focus on the symptom, but any other aspect and form of being, the personal aspect, the mental aspect, and spiritual aspect. And that's why in this research, we're focusing on working with people with insomnia. Because if you remember in the context, I'm gonna, next slide, please. People with insomnia have a high that they're related to with different diseases, like again, not only in the functional area but also in the mind area. A little bit, I'm going to tell you a little bit in the context. People with insomnia worldly is about a 10 or 15%, and this and near the 35% or 25% have suffered insomnia occasionally or on stressful situations. Next, please. So we can, in order to define the insomnia disorder, we see also the definition on the book of insomnia, which defines the insomnia as a sleep-awake disorder. It not only affects the quality of the sleep, also the amount of sleep. And this DMS, we also have some diagnoses that we still need to check up, and we're going to see them on the next slide, please. One of the main criteria is that people has difficulty to start sleeping, also to maintain the sleep, also that they awake often during the night or wake up early in the morning and can't come back to sleep again. Other criteria also relate to the insomnia happens even though the conditions are favorable. For example, you have a nice light, the bed is comfortable, and the room temperature is adequate, you still have this disorder. And also happen at least 3 times a week, and it happens in 3 back-to-back months. Between the symptoms that may produce the insomnia is to stay awake during long periods of time, to wake up many times during the night, to not feel well rested after sleeping, to feel fatigue or sleep during the day, have difficulty to focus on a task, or feeling irritable. Next, please. Also, insomnia is related to other disorders, other pathologies. For example, diabetes, fibromyalgia, heart diseases, breathing disorders, and not only the functional physical part, but also some psychological issues. For example, depression, bipolar, and schizophrenia. Next, please. Also, we have to make a difference that even though the insomnia is one of the most common pathologies worldwide, there's also some other disorders that are related to the insomnia. One of these is narcolepsy, where the person has a lot of difficulty to stay awake for many long periods of time. He falls asleep during the day, and also beside, even though he's sleeping at night. Another pathologies like parasomnia, is there are disorders when the mobility suppression is working properly, when the person wakes up and does activities without noticing. Also, with another differential disorders is with breathing disorders, and what corresponds to the normality when we're going through an important stress period, which also the sleep disorder related. Well, with the different treatment that there are, we have many different ones. And in the same area, we also have the medicine, for example, benzodiazepine, which are related to hypnotics and sleeping doctors. And we also have research in areas where the person is allowed to change their habits of sleep. For example, conductual therapy, and also meditation is recommended, relaxation, direct relaxation, which are areas that are helping the person to improve their sleepiness, sleep quality. So nowadays we have noticed that even though those help people a lot in the same problem, many of them, when they drop the treatment, the symptoms come back. And that's why, and I'm gonna ask you to go to the next slide, please, that we have thought that effectively we can complement this with something more deep and also more to the origin, which is something that helps make an association with the past life therapy and work with insomnia disorder patients and see if this can be a complement to the conventional treatment. Why do we think this? Because past life therapy is a transpersonal therapy that makes conscious the unconscious, and in words of their creator, Dr. Cavoli, the past life therapy goes beyond what is deep, and also we think that it can be a complement for the treatment of the people with insomnia.
Good. As I was saying, we think that past life therapy can be a complement to the conventional treatment that these people are having, because it's a therapy that goes beyond the origin. It goes to the symptom and it goes to the soul. For the soul, time doesn't exist, so it is all happening here and now. So if we're gonna get deep in the origin, we're going to possibly find a big help for people with insomnia. Please go to the next slide. So that's why that we ask ourselves the next questions for the study. Next, please. Which are Past life therapy is effective as part of insomnia treatment, and can we consider it as a valid option to integrate it in the healthy process of our patients? With that, we ask ourselves with the research. Please go to the next slide. Next. Thank you. We designed analytical perspective pilot clinical study, and we have included 10 people that have complied with the inclusion criteria. Next, please. Within our inclusion criteria, we have male and female with a medical diagnosis of insomnia, people from 18 years old up until 65 years old, people with from any race and socioeconomical level, people from any educational level, Spanish-speaking people, and people that can attend in person, and persons that are older than 18 years or older than 65 years old, people with psychiatric pathologies and with no neurological diseases, and patients that are addicted to illegal drugs according to the Argentinian laws. Next, please. Each participant is given an informed consent according to the WHO lines, so that we can inform the conditions of the study. They also said that they will inform us all of the variants that we'll have in the intervention process, as well as if their medical treatment will vary, if they will increase or reduce the medical treatment, or if the practitioner will give them another instruction. They would also tell us if they would have more or less symptoms. Next, please. Within 2 months, there were made 3 sessions of the past life therapy with the method of Dr. Caboli. And this would have the span time of 2 weeks. In the first intervention, and it was a multi-central study with people from Argentina, Chile, and Italy would participate. Next, please. So that we could measure the parameters of change that could have happened in the study, we created a perception survey based on the guidelines of the WHO, where we found in this survey 9 questions of alternative with the symptom, with 5 categories of response treatment, which would be always, frequently, often, rarely, never, and then we would see in the therapeutical process, and then when ending in the process of past life therapy. Next, please. Within the outcomes we had, next, is that the participants were in the age range from 25 to 53 years old. 50% of them were having a treatment with some kind of medicine, and the other 30% were doing some kind of behavioral therapy. It could be meditation, some kind of behavioral sleep, and within the participant that did the study and that ended it, only 8 of them did the complete study, the complete session, and the other 2, they justified saying that one of them couldn't participate because of personal reasons, and the other said that the therapy wasn't for him. Next, please. So the results that we had is shown in the graphics that we're gonna see now, based on the 8 people that ended the study. The first one that we saw was the people that could sleep at night, with the people that started the study, which are the gray one. They say that they all would always and frequently sleep, and the orange one that are the final, they had lower values, which they would say never and rarely. So in a qualitative level, you see a diminishing of symptoms based on the initial phase. The second symptom is staying awake during long periods of time. We saw that most participants had a high rank in always and frequently, and when they ended the study, you saw a diminishing of the symptoms, where we frequently saw they stood awake in the night. They said that never, and the symptoms really lowered in this category. Next, please. And the third symptom, waking up many times during the night, we saw that it was we had more dispersion of the value in the principle. They initiated with always and frequently. However, when the study finished, we saw that this impression lowered, getting to the categories of rarely and never. That shows that the symptom also lowered, decreased when we finished the therapeutic treatment. Next, please. The fourth symptom, waking up early without being able to go back to sleep, we saw again that we begin with a high score and we ended with score of rarely and never, and that shows again that the study ended and it decreased the score of prevalence of the symptom. Next slide, please. Not feeling well rested after sleeping. We had a really important improvement here. The participants started with a high rate and will always and frequently, and rarely and never were the values that we saw when we ended the study. That means that we had a decrease of the symptom when we finished the intervention. Next slide, please. Again, feeling tired or sleepy during the day, we saw a dispersion in the categories. When we finished the study, we also had a decrease of this symptom, where people were in the categories always, rarely, and never. Next slide. Having difficulties to focus on a task. We also saw a decrease when we finished the study. We see that we began with a higher prevalence in the frequently category, and we finished this intervention of the symptom. We saw that there was a decrease where we had rarely. That indicates again that diminishing of the symptom when we finish the intervention. The last graph is related with the feeling irritable symptom. We see that most of the participants of this research begin with a higher value and frequently is most prevalent, and we ended the intervention. We see that this category changes to rarely. So that shows that we had a decrease of the symptoms when we finished the intervention. Next, please. Some participants in this study ended with important categories of the decrease of symptoms and other diminish in a lower level, even though they had a lower symptom, and we didn't see an increase of the symptoms. So none of them that ended the study had more serious symptoms when they ended. And the ones that didn't finish the study, one of them specifically said that even though he hadn't finished with the first intervention, he had subjective increases, but we couldn't include that in the graphs because he couldn't conclude the study. Next, please. Next. Thank you. As we saw in the graph analysis, there was a decrease of the symptom of the frequency and the intensity, even though we see qualitative even though it is a little sample, we couldn't get more specific, even though the study is still ongoing and it's just starting. We feel that we have contributed with a new line of research with transpersonal therapy and contributing with the specific part of this technique, saying that it is a valid technique for science and that it can help a lot of people. Thank you. Next, as we're finding a diminishing of the symptoms, we can also observe that the possible origins of the insomnia is related to many causes, not only from this life, but also from past life. And there are sayings that if I sleep, someone dies, and I can't lose control. And there was saying regarding with promises, I promise to take care of you day and night, and we have traumatic experiences that are related with this insomnia. Even though we can help with psychotherapy, complementing the treatment, it doesn't include this technique because many times the psychotherapy is related with the work of this life, or what is happening with the what's going on in the person's life. And we have this, what we find in this past life, we can find more efficiency with the treatments that we're having. So what we found in our research, it indicates that it can actually help past life therapy in insomnia treatment.
And as a conclusion, next please. Could be the past life therapy an option to keep in mind when at reducing the control and controlling the symptoms of the disorder? We have research on this disease, but we also think to keep exploring with other health areas. We know that this research is a starting point, we're just starting, but it's not the less, because we are on a good road to contribute and give a grain of sand to this marvelous transpersonal technique. Now, thank you very much to everyone for being here. Next slide, please. Thank you. And also next. And here we are, all the participants of the study, of the research. Specifically, the people here are the ones that participated initially. There's more girls missing that they are already working with us today. But so if you're here, you're listening this and you're near, I don't know, from Chile, Argentina, Italy, and you can go in person, we give you the welcome so we can keep on the research on this area. Thank you very much. And we want to extend the welcome for a roundtable tomorrow so we can answer all the questions
Super.
from our
Muchas
audience.
gracias.
What do you think? Yes, great.